my name is Madeline. I'll be your nurse today. I will be performing a head-to-toe assessment.
Okay.
Before I get started, I need to make sure I have all my supplies. I have my stethoscope, I have my gloves, I have my hand sanitizer, my alcohol swab, and my pen light. I'm going to perform infection control before we get started. And hand hygiene. Before we get started, I have a couple questions to ask you. Do you have any assistive devices?
No.
Okay, and if at any time during the assessment you have any pain, please let me know, okay? All right, your name?
Hannah.
Where are you?
Old Orchard Beach.
And the day?
Sunday.
Okay. Patient was alert and oriented ×3. Speech was clear, not slurred. Level of consciousness was appropriate, able to respond to questions. And now I'm going to give you 3 words to remember to ask you at the end of the assessment. The 3 words are sun, dog, and tree.
Sun, dog, tree.
Okay, awesome. Now to assess your cranial nerves, I'd like you to smile and frown and puff out your cheeks and raise your eyebrows. Okay, patient's cranial nerves are intact, was able to respond to commands. And now to assess your fine motor skills, I'd like you to touch your fingers to your thumb. Okay, patient's fine motor skills are intact. And now I'm going to have you close your eyes and I'm going to assess your sensations. So I'm going to touch somewhere on your body and just let me know where I touch, okay?
Mm-hmm. Right foot, left hand, right hand, left cheek.
Okay, patient was able to differentiate between the lower and upper extremities and the face, so patient's sensations are also intact. Now if you could get up and go to assess your gait, please. All right, now walk to the end of and back. Okay, patient's gait is normal, no swing or limping. Balance and coordination was also intact. Now to assess your balance, I'd like you to stand on one foot and the other. Okay, patient's balance and coordination is intact, no swaying. And now I'm going to assess your spine, so could you turn around and bend over? Okay, patient's spine is good, no signs of any curvature, no signs of scoliosis, lordosis, or kyphosis, no masses or lesions were present upon palpation. And now I'm going to do range of motion on the upper extremities. First, we're going to start with strength. So can you extend your arms, please? And push against mine. And push against mine. Okay, patient's strength is 5 out of 5, equal bilaterally. And now for range of motion of the upper extremities, I'd like you to swing your arm in a circular motion. Okay, no signs of crepitus, any pain?
Nope.
Okay, and then bend your elbow. No signs of crepitus, any pain?
Nope.
Okay. And for wrist, circular motion. No signs of crepitus, any pain?
Nope.
Okay. Same for this side, circular motion with your arm. Okay. No signs of crepitus, any pain?
Nope.
Okay. Bend your elbow. No signs of crepitus, any pain?
Mm-mm.
Okay. Wrist, circular motion. No signs of crepitus, any pain?
Nope.
Okay. So, the skin on the upper extremities was warm, pink, and dry to the touch. So now I'm going to look at your hands. Okay, patient does not have any signs of clubbing in the fingers. Capillary refill was under 3 seconds on both sides, equal. And skin turgor is good, no signs of tenting, no signs of dehydration. And no palpable masses or lesions on the hands. And I'm going to assess your radial pulses. Okay, both pulses are +2 in strength, equal bilaterally. And now I'm going to assess a range of motion on the lower extremities. If you could extend your leg out. Okay, no signs of crepitus, any pain? Nope. And bend your knee. No signs of crepitus, any pain? Nope. Okay. Same on the side. Bend your leg forward. Okay, no signs of crepitus, any pain? Nope. Okay, and bend your knee. Okay, no signs of crepitus, any pain? Nope. Okay. Now I'm going to ask you to sit down so I can assess your head and neck. Okay, so head is appropriately placed on the body, good size and shape, and now I'm going to Put on gloves to assess your head. Perform infection control. Upon palpation, there are no palpable masses or lesions, no signs of critters. Hair is evenly distributed, texture and color is appropriate. Okay. Skin on the face is pink, warm, and dry to the touch. Neck is erect and midline, and if you could swallow. Okay, patient swallowing is intact, and thyroid is not palpable, therefore there's no signs of goiter. And now I'm going to assess your frontal and your maxillary sinuses. If at any time you feel any pressure, just please let me know. Okay. Nope. Okay. Patient does not have any signs of pressure in the maxillary sinuses, no signs of infection. Now I'm going to assess your lymph nodes. No hardening of the lymph nodes, no swelling, no signs of infection. And now I'm going to assess your spinal accessory nerves. So I'd like you to raise your shoulders against mine. Okay, spinal accessory nerves are intact. And now I'm going to assess for TMJ in your jaw. Open your mouth. Okay. No signs of crepitus. Was there any pain? Nope. Okay, so now for some range of motion exercises in your neck. I'd like you to bend your head down and backwards, inside, and outside. Okay, patient reported no pain when doing range of motion exercises. So now I'm going to assess your ears. Okay, upon palpation, there's no lesions, nodules, or any signs of redness, or now I'm going to assess for drainage. No drainage in the ears. The ears are appropriately placed and proportional to the body. And now I'm going to perform the whisper test. If you could respond with what word I whisper in your ear. Dog. Cat. Okay. Patient was able to pass the whisper test, had no signs of difficulty with hearing, and was able to recall the words appropriately. Now to assess your eyes, your sclera is white. No signs of jaundice. Eyebrow hair and eyelashes are appropriate to the body, and there's no edema in the eyelids, and the cornea is clear. Iris is also blue and round. Pupil is 4 millimeters in size and symmetrical size and shape. Your conjunctiva is pink and no signs of discharge. Okay, now I'm going to do a couple eye tests. I'd like you to follow my pen for the cardinal field of gaze test. All right. Okay, patient was able to follow pen light and her nerves are intact. So now I'm going to test your peripheral vision. Let me know when you see my fingers, okay? All right. Yep. Okay. Patient's peripheral vision is intact, was able to tell me where my fingers were appropriately, and now I'm going to test your pupils with my pen light. Okay, pupils were equal, round, and reactive to light, and for the accommodation test, I'm going to move my pen light towards your face, okay? Okay, pupils were consensual and constrictive, bilaterally accommodating. And for your nose is appropriate for the size of your face, no visible abnormalities. Do you have any difficulties smelling? Nope. Okay, so I would like you to place one finger on one nostril and breathe in, and the other one. Okay, patient's nostrils were clear both bilaterally, and I'm going to assess for drainage. Okay, no drainage is present, and no signs of a deviated septum. And now for your mouth, your lips are pink and moist and appropriate to your face. And I'd like you to open your mouth, please. You can say, Okay, uvula is midline, tonsils are intact, mucosal membranes are pink and moist, and your teeth are healthy, no signs of plaque. And could you stick out your tongue for me? Okay, patient's tongue does not deviate to any side, and there's no odor present Also, there's no signs of cyanosis, and your skin on your face is pink and dry and warm to the touch. Now I'm going to palpate your precordium, give me back. Okay, there's no palpable flatters, no signs of heaving or difficulty with breathing. Now I'm going to listen for your heart sounds. I'm also going to auscultate with my bell. Okay, no abnormal rates or rhythms are noted, no whooshing sounds are present. S1 and S2 were present, which means your mitral and your tricuspid valve are working correctly. I'm also going to assess your carotid pulses. Pulses were equal in strength, both bilaterally. I'm going to auscultate them now. Also going to auscultate with my bell. Okay, carotid pulses were +2 bilaterally, no bruits or whooshing sounds were present. Now if you could stand up, I'm going to check your lung expansion. If you could turn around and face the wall, and inhale, and exhale, okay. Patient was able to inspire without difficulty, no barreling of the chest, chest is cone-shaped, and lungs inflated bilaterally symmetrically. So now if you could sit down, I'm going to listen to your lung sounds. Now I'm going to go to the back. Deep breath. Deep breath. Deep breath. Deep breath. And one more deep breath. Okay. Patient lung sounds were present, equal bilaterally, no crackles were present, and the sounds of bronchi or wheezing were also present. So now, do you remember the 3 words that I asked you?
Tree, dog, and sun.
Okay, awesome. So patient's short-term memory was intact, was able to recall the 3 words. And now, if you could lay down and bend your knees, I'm going to listen to your vowel sounds. Do you mind if I pull up your shirt?
No.
Okay. Patient's skin is warm, pink, and dry to the touch. And now I'm going to listen in all 4 quadrants for vowel sounds. Okay, there's no signs of hyperactivity or hypoactivity. Vowel sounds are present. And now I'm going to listen for vascular sounds. Okay, vascular sounds are present, no signs of an aortic aneurysm. And now I'm going to palpate your abdomen. If at any time you have any pain, please let me know.
Alright. No.
Okay, patient does not report any pain upon palpation, no visual masses or lesions, no masses or lesions were present either when palpating, and skin is pink, warm, and dry to the touch. Okay, now I'm going to do range of motion on the lower extremities. If you could spin around. Okay, first we're going to start with strength, so if you can extend your legs. Okay, and push up against my arms, and push down. Okay, patient strength was 5 out of 5, on both legs, equal bilaterally. And now for range of motion exercises in your ankles, I'd like you to move them in a circular motion. Thank you. Okay, no signs of crepitus, any pain?
No.
Okay, now I'd like you to spread your toes. Okay, and there's no signs of clubbing, and the feet and nails are intact. Capillary refills is under 3 seconds both sides. Skin turgor is good, no signs of tenting, no signs of dehydration. And now I'm going to feel your dorsal pedis pulse. Dorsal pedis pulse is 2+ in strength, equal bilaterally. And now for your posterior tibialis pulse. Okay, posterior tibialis pulse is 2+ in strength, equal bilaterally. And skin on the lower extremities is pink, warm, and dry to the touch. Do you have any questions?
No.
Okay, that'll conclude our health